Coronavirus. Again, this information just coming into our newsroom less than an hour ago. As you may remember, we heard about the first case of coronavirus on Tuesday in Kern County. However, public health officials said because that case was a non-resident, they were not considering this a case in Kern County, although the person is at home and recovering. These two new cases are residents of Kern County. Their results came in this morning, and again, that brings the cases up to 3, meaning there are 3 people here in Kern County that have tested positive for coronavirus. Again, 2 residents that tested positive today, 1 non-resident who was passing through visiting family in Kern County tested positive earlier this week. Again, we are awaiting a news conference from local health officials that is supposed to take part in just a moment, and it looks like it looks like they are walking up and getting ready to speak here. So let's take you there live as they get prepared and listen in.
Constantine, Kern County Director of Public Health. We're joined for the first time with an ASL interpreter, Stephanie Smart, from the Independent Living Center. So we're honored to have her here with us this morning. Late yesterday evening and around midnight this morning, we received notification that 2 Kern County residents tested positive for COVID-19. This marks the first 2 cases of COVID-19 in Kern County residents. Both of these residents are recuperating at home. We are currently investigating these 2 cases to determine what their potential exposure sources were, and if they themselves have exposed any household or close contacts. With these 2 identified cases, it's a good reminder for our community to continue their efforts and their diligence to practice good hygiene and stay home when you're sick. And as you know, these measures will dramatically reduce your risk of exposure and reduce the chances that you may impact others. As an overview, in the U.S., as of March 18th at 4 p.m., there's 7,038 cases with 97 deaths, and now we have affected all 50 states. In California, we have 598 cases with 13 deaths. In Kern County, as of March 18th at 3 p.m., we have 123 tests that are pending and now have 76 tests that are negative. As we mention each time, our monitoring program, there are 30 returning travelers that we have had or are in the program. 22 have either not needed to continue their program or have completed it. We received notification from the California Department of Public Health yesterday, though, that they will not be sending us any new traveler information. CDPH, the state public health department, has indicated that community spread from returning travelers has proportionately diminished due to the amount of community transmission that exists in the state now. So the number that we will be reporting on will never exceed 30, and as those transfer through the period, those numbers will then diminish. We've also stood up a website that's behind me that is going to provide real-time data so that you have access to the numbers. You'll notice that the positive detected is still at 0. That will go to 2 as we leave here today. This will be updated routinely so you have the most current information. And I want to again reiterate that the county and our incorporated cities and our first responders and our healthcare professionals are prepared. We have practice for events similar to this, similar to events that stress our infrastructure, that place an increased demand on our services, And we have set aside both medical and health-related supplies for events just like this. And finally, I want to mention again that this is our time when we need to ensure our families are safe, our friends are safe, and that we reach out to our community members. You have individuals in our community that perhaps have a compromised immune system or that are older. It's our obligation to look out for them and to knock on the door and to help. That concludes my formal comments, and I'm happy to take any questions you may have.
Are these two new cases connected to the previous case that we were monitoring before?
So what I will report this morning as these are 2 new Kern County residents that have tested positive.
And no need for community to be worried about their goings on during this whole process?
So we are currently investigating where they potentially were exposed and if there was anybody that they may have exposed. That is our investigation that we're doing actually as we speak.
Can you confirm which cities in Kern County these 2 residents are from?
So what we will confirm is that they are Kern County residents, but no further than that.
Is there a reason why we aren't able to disclose
Sure.
which cities that they're
Sure.
from locally?
So we want to ensure that we protect the health information and the individual themselves, and we take that seriously, not only because it's legally prohibited for me to release, but ethically, that is not something that we want to do.
Are these 2 separate households?
These are 2 separate residents.
What about the age? I mean, other news stations across the country have been at least giving a range, so that's less identifying in lines with the HIPAA laws. So can you at least give us an age range between 30 and 40? You know, especially since there's been new reports that the younger age groups are starting to become an issue. So if you could give light on just what we're experiencing right here in Kern County in a sense of just a range so that it will protect patient information as well as inform the public.
Sure, I understand the question. And as you're aware, as we've watched the transmission of the disease through the United States and through the world, we have seen disproportionately that those that are older suffer greater consequences, especially in the United States. We've watched that carefully. And previously, we've noticed that children aren't as affected. We have seen some numbers worldwide that may change slightly, but as it stands today, what I'm releasing to you is there's 2 Kern County residents that have tested positive. We're not going to release any more information about those individuals.
These 30 return travelers,
Yes, ma'am.
Are you able to confirm, are these mostly international travelers or domestic travelers that you've been monitoring?
Right. So under the CDC program, anybody that returned from China or Iran were screened by the CDC at one of those 11 airports. And if they met certain criteria, then the CDC sent that information to the state, and the state sent it to us for those that we should assess and, if appropriate, monitor.
So piggybacking off of that question, can you tell us right now if these are travel-related cases?
I cannot.
So to confirm, those 30 cases, they're just from China and Iran. Would that be accurate to say?
Yes, that's correct.
So what would have to happen? What would have to happen to require us to be in a shelter-in-place scenario?
So our interest today is to do everything we can to protect our residents. We've been trying to provide information that is helpful to the residents of Kern County. That's why we're sharing all the data for you. The actions that the governor has taken and that the guidance documents from the state have been helpful into limiting potential exposure and to limiting the impacts to others for those that are sick. And I believe those actions are going to be helpful. As you've noticed in our community, people are listening to them and they're taking that seriously, and that message has been received. As we watch nationwide to see how COVID-19 is spread through the United States and how it affects different communities, I think every community is making up their own decisions on how best to protect. And we've seen in California, different cities and counties have taken different actions. As we stand today, this is evolving. We now have our first cases, and we need to evaluate potential risks and take those actions necessary to protect. Beyond the actions that the governor has listed and the guidance documents, at this point, we're not recommending any further action.
Is the risk for transmission still low now that we have 2 residents?
So again, this is changing. We're still investigating these 2 cases. We need to understand more, but I believe that with information that we will learn, that community transmission may be likely now that we've seen these cases. We still have some more research to do, but these 2 cases show that the disease is here and that the potential for community-wide spread may exist.
And you said those travelers are from Iran and China. How about Italy? Are any of those travelers being monitored?
So initially, a few days ago, the state indicated that, and CDC indicated that European travelers were also going to be included from certain communities, certain locations. And we were told Tier 3 countries would be included. With the change now in the state's action, because of the spread within the state, we will not receive those names. Other states may take different action based on the presence or absence of COVID-19 in those communities.
At what time did you learn about the 2 cases, and are they interconnected?
So we learned about the first case in the late evening, and the second case...
Last night.
Yes, sir, last night, and the second case around midnight this morning.
Is that correct?
And also, are they connected? Are they interconnected with each other?
So these are 2 residents that tested positive. We don't believe there's any connection, but we still don't know. We're still doing our investigation.
Matt, you said 123 pending tests, but it says 192.
So-
Is that more
So let's check
recent
our numbers. And my numbers could be outdated because this is changing quickly. So I will ask for clarification, but I show 123 and that shows 192. So I'll get you clarification.
Is there a designated time you guys going to make sure you get that?
So it notices that 10 and 4 this is updated. So I don't. Michelle, do you have updates?
Your current, this is going to be updated very soon.
So the 123 is correct. The 196 is not.
Correct.
Okay. So
193 pending?
192?
Michelle.
What do we know what that one?
I show 123 pending results and 76 are negative.
And that's from so that is correct.
My numbers are correct.
Yep.
We just turned this on before we came down.
Do you plan to announce after you start investigating, like these people went to this restaurant or to the mall or wherever, will you be announcing that to the public?
If that information is relevant, if we are concerned that somebody that was positive potentially exposed the public, then yes, we will release information because that is relevant to the community about potential exposure. If it is limited to individuals, we will make individual contact with them.
Does the county and city need to change or make any action now that we have these 2 cases?
This is too early to make that determination. I think those are discussions that should happen as we track the disease progression in the county. But as it stands today, no.
Are you surprised that we have 2? I mean, we have 3 cases currently, right? Because that other person is still.
So as it's defined by law, we have 2 cases and a visitor. So yes.
So are you surprised by the 3 cases? Do you have any estimates on projections on how many more we might see? Is that something you guys talk about?
So we're not surprised. We've been watching carefully how the disease has progressed through different communities. As we've stated multiple times, we don't believe we're immune, that this would affect us also. We do not have any specialized modeling that the general public doesn't have access to. It looks like the numbers are changing again as we speak. So we've seen estimates. We've been trying to run those numbers too in general, but I don't have anything more specific than what's been promoted online.
Thanks. I have the people have many questions. A lot of them were about whether or not there are free tests out there, because if they didn't have insurance, it was
Sure.
$25. Is there a way to get a free test?
Sure. So the answer that I'm aware of is some healthcare providers have eliminated some of the cost, right? Some of the deductibles. We've heard of some waiving the cost. I'm not certain about free tests. We have a group that is evaluating where testing is being done. Is there shortages of supplies? So we can certainly evaluate and look for options for reduced or free costs for testing.
Is there a concern about shortage of tests because that's happening elsewhere?
So we're tracking this really closely. We have a lot of local providers that have a supply, and they're doing a lot of testing. They're doing drive-through testing. We have the hospitals that are doing testing. We at times have seen shortages due to contractual arrangements that they've had to find a different lab. We have heard statewide there are at times shortages of either the swabs that they need or the preservatives or even the laboratory equipment that's needed, but that seems to change quite often. As it stands now, we're not aware of a sustained shortage in Kern.
Do you know how many tests we have available here? Is that a number you guys track?
So as it is now, your doctor is able to make that determination if you should be tested, and then they use their contracted lab to do it. So every time a doctor believes that there is a suspected case, they are required to immediately notify public health. That's in law. Once those test results come back, then that's also reportable to us. We have seen at times that the doctors are not telling us about those tests that they are running. We have regular communication with them, so we've included that in communication yesterday that said, please ensure that you're notifying public health of any suspected case that you're testing. So I don't have, beyond what is being publicly discussed, the 123 tests that are pending, I have no further information.
Are people safe to go to parks and do things outside and exercise outdoors, things like that?
Yes, they are. We need to think about the guidance that has come down from the state about ensuring that we are not in larger gatherings and to figure out ways to stay away from people that are sick and stay home if you're sick. But other than that, yes, we believe that is still the best course of action. It's nice to get out, especially this time of year, go on a walk or a jog. That is appropriate.
Are there any precautions that people should take, considering that, at least for me, this has been a question, this is droplets that would need to dissipate to the ground in light of gravity. So if someone was to walk through the hallway after someone was to sneeze, who was infected potentially,
Sure.
could that be of risk if you're just out in your daily life? I think that's some overbearing concern that some
Sure.
people may have. So if we can just clarify that a little
Sure.
bit, like that going to the park or walking
Sure.
outside where someone just sneezes isn't an issue.
Sure. So the science shows that you need sustained close contact with somebody that is infectious and symptomatic. That generally doesn't happen in incidental or very short, brief interactions. We've talked about the 6-foot separation that dramatically reduces. In addition, even if you're within that 6-foot zone, it takes some time for that transmission to occur. Is it possible that transmission could occur in the situation that you've stated? Yes, but it is unlikely. We also have Ellie here that will be able to take any questions in Spanish, and if that's of help too. Yes, sir. Any other questions?
You said this will update again at 4 o'clock?
At 10 and 4 every day. So yes, it should be up to date on those, and it notes that on the website. We'll clarify the testing for you too, as we want to make sure that's really clear for you.
Well, actually,
Okay.
Michelle did just say that
Did she?
this is the most current.
Oh, we've changed direction.
While you were talking,
They updated. Gotcha. So that's part of the real-time update issue that we face, that as I left upstairs and we reviewed, it was 123, so it changed. Okay, thank you for coming.
We do have one more question coming
Yep,
in right now.
sure.
They wants to ask why you guys waited until at least 10 hours to make an announcement if they learned about them last night.
Sure. So we get notification, as you've seen, 24 hours a day. That comes in through a after-hours number. Oftentimes, those notifications are not complete, and they do not have complete demographic information. So we actually have to spend some time contacting the individual that's listed to ensure that the information is correct and fill in the missing information to determine if they are a Kern County resident. And that takes a little bit of time, especially at night.
Yeah. Did you guys make contact with them last night? Did you guys show them to their
For,
house at midnight?
for both of them, we made contact, yes.
Okay. Are there any measures that maybe can paint that picture for viewers in a sense of what that quarantine maybe looks like? It's not an average quarantine because I'm quarantined myself at home. What's this quarantine look like?
Help me understand your question.
So
What
pretty
quarantine?
much like we're all self-quarantining, right? Most people are trying to, right? Not just the elderly community.
Sure.
So these people are, you told us, are self-isolating at
Yes,
home.
yes.
Are getting better at home.
Yes.
Are there any other measures that maybe outside their home or inside their home that are being taken to preserve the health of the community?
No, because they present no risk to the community. They're self-isolating. They understand the importance. They're recuperating quickly. So no further actions are needed.
And then in terms of them leaving?
Leaving
their home? Are there people helping them get supplies in home?
Yes, so we've asked them not to be out into the community until we have provided clearance. We want to make sure that they're not contagious and that they're healthy before they resume their normal activities.
Did they have any symptoms? Is that something you could share?
So at this point, I'm just going to say that there were 2 positive residents. Yeah.
All right. The first, the non-resident, that individual's still here.
So I'm not going to go into detail about the individuals because that, again, infringes on their medical rights, and we don't want to identify the individual. So I don't think it's appropriate for us to provide any information. Okay, thank you very much for coming.
All right, you've just been listening to Matt Constantine, the Director of Kern County Public Health, who is just giving us, again, the latest information on the 2 residents here in Kern County who have just tested positive for COVID-19. Now, let's just kind of recap what we've learned from this news conference. We learned that public health officials were notified late last night into the early morning hours of today about these 2 residents that tested positive for the virus. Again, we do not know where these people live. We don't know what area of Kern County they are from, but we do know that they are at home and they are recuperating at this time. We don't know their ages or any information about these 2 residents, about these 2 patients, other than that we do know that they tested positive for the virus. We've also learned that 192 tests are pending right now. That is up from 123 tests that we've been reporting this morning. That number just updated within the last 23 minutes or so. So again, 192 tests here in Kern County for COVID-19 are still pending. We do know that 76 tests have negative results. So of course, and that just shows you that there are still a lot of people who are showing very similar signs to COVID-19, but their results come back negative. Matt Constantine talked about right now that public health officials, local public health officials, are actually trying to figure out and trace who may have been exposed to these 2 residents over the last several days, if not weeks. As you know, it can take up to 14 days for someone to show symptoms of COVID-19. So he said that as we speak right now, local public health officials are trying to trace the people that may have been exposed to this virus. Now, one of the things that he did talk about in this meeting was community transmission. You may remember on Tuesday when Matt Constantine talked about this, about that first case, saying that it was a non-resident of Kern County, it was a traveler. He said that the risk is relatively low for the general public here in Kern. That sentiment has changed, it seems like. He said based on what he knows about this virus, what he knows about the 2 cases, he says that community transmission is now likely in Kern County, so kind of changing his tone a little bit from what we heard a couple of days ago. Now, as you know, there are several counties here in California that have talked about community transmission being widespread, especially in the Bay Area and down in Los Angeles and San Diego County. So again, this is something that is not new to the state of California, new to the U.S., but it is a little bit new for us here in Kern County, as we have just confirmed our first 2 residents that have tested positive for coronavirus. Now, one of the things that Constantine did say was that they are not running out of tests. There are plenty of tests to go around. So for those people who are showing signs and symptoms of coronavirus, they will get a test. Now, earlier this morning, if you were listening to the news conference from the White House task force and President Trump, they talked a little bit about the tests that are being distributed across the nation. And they said that primarily 50% of coronavirus cases are coming from 3 states that include Seattle, Washington, New York, and California. So a lot of those tests, a majority of those tests are going to be given to those 3 states because more than 50% of the cases come from those 3 states. We also know that the U.S. has just surpassed a milestone marking more than 10,000 cases of coronavirus. And again, that makes the world total to more than 229,000 cases. So again, you just see that this number continues to climb, and it is going to continue to climb as this disease spreads. We, of course, have a lot of information on the coronavirus on our website, kget.com. There you'll also be able to find the symptoms of coronavirus. And let's just go over those symptoms really quick to talk about the difference between the coronavirus, the flu, and allergies. The symptoms for coronavirus, the most common symptoms are fever, dry cough, shortness of breath, and fatigue. Now, you may notice that those are similar symptoms to the flu, which include fever, cough, a runny nose, body aches, headache, sore throat, and fatigue. So there's a lot more common symptoms for the flu. One of the biggest symptoms that you will notice with the flu is body aches and joint pain. That is a symptom that you will not necessarily see with coronavirus. Of course, it is still possible, but it is very rare for people who have coronavirus to experience body aches and joint pain, according to the CDC and other health officials. So keep that in mind. Although, again, they are still very similar. The coronavirus and flu have similar symptoms. Some of them are very different. Now, allergies are going around as well, especially in our community. As you know, today is the first day of spring. We had kind of a warmer winter, especially a couple weeks ago, which meant a lot of the trees and flowers blossom, and of course that kicks up a lot of allergies. Those symptoms include itchy eyes, congestion, runny nose, sneezing, and coughing. And sometimes that cough can produce mucus, unlike coronavirus, which is going to be a dry cough. So keep that in mind, that again, you see some similar symptoms, but they are still different. We again have all of this information on our website, kget.com. You can also find our past coverage of the coronavirus and how it's impacting businesses, schools, and other organizations here in the county. All you have to do is go to our website, kget.com. Coming up, we will have an hour-long newscast starting at noon today with the latest on the coronavirus here, not only in Kern County, but also across the world. We'll see you back here at noon.